In this video, we'll be reviewing how multiple WD checklists can be used to provide comprehensive life-saving care. You'll recall that newborn Jane Tomba is sick. She has respiratory distress. Her respiratory rate is 82. We know that respiratory distress in the newborn is considered sepsis until proven otherwise, so we pulled out the Rule Out Sepsis checklist and through it recorded a complete medical note, seen on the right, sent out diagnostic studies, and administered fluids and antibiotics. All this we did in not more than 2 minutes, saving the clinician valuable time while protecting both clinician and patient from common drug selection and dosing errors. But Jane also needs respiratory support. The original checklist reminds us this and directs us to open up the Continuous Positive Airway Pressure or CPAP checklist. Installation of CPAP frankly is involved and requires separate detailed focus. In the WD system, it's easy to add additional checklists to the patient encounter, though one checklist typically does the job. We go to the bottom of the primary checklist, which for convenience can also be collapsed. I like to do this. There you will find the Add Checklist box. Typing in CPAP or any part of the term pulls up the appropriate checklist. We select. Unlike the checklist for sepsis, which is initiated away from the patient, the CPAP checklist is best filled out next to the patient as installation of CPAP is quite technical. This is why the WD system works just as well on an electronic touchpad as it does on a stationary personal computer. In terms of format, the organization of the CPAP checklist is also a little different from a typical WD checklist. It still provides relevant background, but the checklist excludes the history and physical exam sections because history and physical findings from the previous checklist rationalize installation of CPAP in the first place. The checklist does recommend additional studies to perform, including options to look at oxygen and CO2 content in a blood gas or radiologic view of the lungs. Many WD sites do not have this capacity, but they are listed as options, an aspirational standard if you will, but not having access to blood gas or chest x-ray does not preclude installation of CPAP. Let's move to installation. The WD CPAP treatment section provides systematic, clear, step-by-step support for CPAP installation that few individuals, frankly, will be able to remember otherwise. First, it verifies respiratory criteria for installation. Second, it lists contraindications for CPAP use, such as facial anomalies or apnea. In these cases, alternative breathing support measures need to be located. 3, it helps you to properly adjust the machine settings, including visual decision support of the machine settings. 4, it guides the user as to how to attach the CPAP to the baby, again employing visual decision support. 5, it asks the user to verify that CPAP is helping by recording clinically relevant findings such as echo breath sounds and improvement in vital signs. Finally, when the user is finished, it provides real-time feedback to the user as to whether their documented actions have met diagnostic, treatment, and patient education standards. Let's install the CPAP onto baby Jane Tomba. The baby has retractions as noted in the previous exam, so meets the application criteria for CPAP. There are no contraindications for the CPAP installation. We find the right side prong based on Jane Tomba's weight. We fill up the water basin to 6 centimeters. We turn the machine on. Because Jane's saturation is greater than 94%, we turn off the O2 meter. And to make sure the settings are right, we consult a visual decision support image. Next, we attach the CPAP prongs to the baby, ensuring that the prongs do not push too much on the septum, as this can harm the child. We secure the tubing to a cap placed on Jane's head. It looks like this. And finally put a pacifier in Jane's mouth. We make sure that there's symmetric aeration to auscultation and that there has been a difference in respiratory rate. Concluding our installation, we see that we have met diagnostic and treatment standards for CPAP application via WD's unique red light, green light quality care assist system. The standard details can be examined by clicking on a quality triangle. For treatment, we are happy to see that we have fulfilled all the steps for proper installation, from selection of the right size nasal prong to confirmation of symmetric aeration. Look what happens when we take away one of these essential steps. There's only one thing left to do. We need to talk with the family about what is this machine and reasons to notify the staff. Doing this turns the quality rectangle for patient education green. This concludes the instructional video on how multiple WD checklists can be used to provide comprehensive patient care. Use of multiple checklists is usually not necessary in the WD system, but particularly when vital technology is applied or procedures are necessary as a result of a diagnosis, application of an additional checklist helps the provider remember essential care steps.